Hello dear friends, how are you doing today? I hope you are doing well. We are going to talk about pigmented growths. Abstract: the skin has one pigment forming cell, the melanocyte. Melanocytes are dendritic cells found in the basal layer of the epidermis. Nerve cells, a type of melanocyte found in the basal layer of the epidermis as well as in the dermis, are arranged in nests and do not have dendritic processes. Melanocytes contain tyrosinase, the enzymes necessary for pigment melanin synthesis, and are thought to be derived from a progenitor cell in the neural crest. Pigmented growths are the result of an increased number of melanocytes, nerve cells, or pigment deposition. The diagnosis of malignant melanoma is important because it can be recognized early when it is curable. Today we are going to talk about freckle. Definition: a freckle or ephelis is a brown macule found in sun-exposed areas of the skin. The amount of melanin in the basal area of the epidermis is increased with no increase in the number of melanocytes. Freckles: brown macules on the sun-exposed skin of a youth. In epidermis we can see melanin pigmentation in the basal layer. Incidence: freckles are a common incidental finding during a skin examination and are rarely a reason in and of themselves for seeking medical attention. History: freckles usually appear before 3 years of age and darken after ultraviolet or UV light exposure. The patient has a history of sunburning easily. Freckles can fade significantly in colder months. Physical examination: the freckle individual typically has a fair complexion and reddish or sandy hair. Hundreds of freckles occur on sun-exposed skin. They are 1 to 6 mm in size, irregularly shaped, and discrete brown macules. Differential diagnosis: lentigo and junctional nevus can look like a freckle. Actinic lentigo does not darken with sun exposure and is acquired later in life. In contrast, freckles darken after sun exposure and are present from early childhood. Lentigo simplex is acquired in childhood, but lentigines are not confined to sun-exposed skin. Junctional nevi and freckles are acquired in childhood. Darker pigmentation and lack of change after sunlight exposure favor a diagnosis of junctional nevus. The conclusion of differential diagnosis of freckle include junctional nevus, actinic lentigo, and lentigo simplex. Laboratory and biopsy: ordinarily freckles do not require biopsy. Therapy: freckles should be accepted as normal. Prevention by sunlight avoidance is effective but not practical. There is no need treatment for freckles. Pathogenesis: UV radiation induces an increase in melanin pigment in the basal layer of the epidermis without an increase in melanocytes. Clinical case: a 20-year-old woman presents to the dermatology clinic because of multiple small brown spots on her face and forearms that become darker in summer and fade during winter. The lesions are flat, asymptomatic, and have been present since childhood. On examination, you observe numerous well-defined light to dark brown macules measuring less than 5 mm in diameter. The surrounding skin appears normal and there is no scaling or induration. Which of the following is the most likely diagnosis? A. Lentigo, B. melasma, C. freckle or ephelis, D. cafe-o-late spot, and E. junctional nevus. According to our explanations, the diagnosis here is freckle or ephelis. Explanation: freckles or ephelis are small flat brown macules that darken with sun exposure due to increased melanin production, not melanocyte number. Common in fair skin individuals, especially on sun-exposed areas like face, shoulders, and forearms. They are benign and fade during winter when UV exposure decreases. Differential diagnosis: lentigo does not fade in winter caused by increased melanocyte number. Melasma: large patchy hyperpigmentation on the face, often hormonal or sun-related. Cafe-o-late spot, larger light brown macule present from birth and does not fade. Injunctional nevus, uniform brown papule or macule persists year-round. Okay, this was an explanation about freckle. Thank you for your attention.